Excellencies, ladies and gentlemen, the next few years will determine whether we win the global fight against one of the oldest and deadliest enemies, malaria. Since the year 2000, working in solidarity and global partnership, we have made historic progress against malaria, saving more than 7 million lives and averting over 1 billion new malaria infections. This success put us on the path of elimination, giving us a hope of achieving a world free of malaria within a generation. This year, the fight against malaria got harder, but so did our resolve. Despite the COVID-19 pandemic, millions of mosquito nets have been delivered, hundreds of thousands of houses have been sprayed, and millions of children have been protected with seasonal malaria chemoprevention. Over 90% of planned malaria campaigns are on track this year. Thanks to these heroic efforts by malaria-affected countries and their partners, the worst-case scenario of a doubling of malaria death in sub-Saharan Africa in 2020 has thankfully been averted. Although the full impact of the pandemic may not be known for some time, we are determined not to let it undermine our hard-won gains in the fight against malaria. In fact, we can and should fight COVID and malaria at the same time. The key to success is leadership and partnership at all levels, from presidents, business and religious leaders, public health workers, and from every community in countries affected by malaria. We need to ignite a society-wide movement to achieve a zero malaria law. I would like to acknowledge the leadership of the Southern Africa Development Community and the Elimination Aid Initiative in making great strides towards malaria elimination across the region. I am delighted that many SADC countries, including our host Mozambique, have embraced Zero Malaria Starts With Me, a joint campaign of the African Union and the Arabian Partnership to End Malaria, which encourages all citizens to make a personal commitment to end malaria to aid. 3 SADC countries have also launched their End Malaria Councils and funds. Today, I would also like to recognize another important area where the SADC region has been playing a leading role: cooperation to harness real-time data and leverage limited resources to fight malaria. One of the major challenges for malaria programs and their partners is determining the most effective use of limited resources. Countries need to ensure there are enough drugs to treat every case, enough mosquito nets to protect every child, and enough personal protective equipment to keep healthcare workers safe. These procurement decisions have huge consequences and require careful, evidence-based planning and quick responses by countries and their partners in the event of a stockout. Over the last years, we have seen major progress in the use of data for decision-making by malaria programs and their partners. SADC countries have been real innovators in this space. Many countries in the region have been working on systems that allow the use of real-time data to inform real-time decision-making. These countries, which include Mozambique, Tanzania, and Zambia, among others, are now better able to stratify the malaria burden subnationally, enabling them to better target interventions for maximum impact. 40 countries in Africa are also using malaria scorecards, which track performance for accountability and action, thanks to an initiative led by former ALMA Chair and President of Tanzania, His Excellency President Jakaya Kikwete. These clear, reliable indicators allow political leaders to stay informed about how they are progressing against malaria. They also allow the malaria control programs and their partners to use real-time data to drive action. When there is a problem, they need to identify it quickly to ensure the population remains protected. This year has been an especially challenging time for malaria programs, due in part to global disruptions caused by COVID. The Arabian Partnership has been increasing cooperation with countries and partners to maintain a delicate supply chain, respond to upsurges, and provide high-level coordination to resolve bottlenecks. Thanks to this coordination, countries have been able to take flexible, innovative actions to prevent stockouts and keep malaria programs on track. In the SADC region alone, we have seen remarkable examples of cooperation across borders, with countries using real-time data for real-time decision-making. For example, following stockouts of ACTs in Namibia, the E8 reprogrammed the resources to allow rapid procurement of ACTs from South Africa, also facilitated by WHO and the Ministry of Health of South Africa. His Excellency Uhuru Kenyatta, the chair of ALMA, called the Prime Minister of India to request that the delivery of essential health commodities from India to Africa were prioritized. This helped reduce delays in deliveries, including to several SADC countries. The COVID-19 pandemic has shone the light on the importance of timely, accurate, and geolocalized data and modeling for public health. The SADC region has led the way in using this approach to support countries' resilience in the face of the unpredictable barriers that can arise when fighting malaria. We recognize that despite unprecedented mobilization this year, we are still facing an uphill struggle to protect tremendous gains against malaria of the past decades, especially as resources, both in malaria-affected countries and internationally, become scarcer. With this in mind, the RBM Partnership is working with malaria-endemic countries and global partners on a global malaria dashboard to provide a forum for high-level decision-making that will further improve coordination. We believe that the value of greater transparency in improving decision-making will make it better to plan and predict resource needs to fight malaria. Together, we can harness the power of data, innovation, and cooperation to achieve malaria elimination in the SADC region and across the African continent. Zero malaria starts with all of us. I thank you.